All right. So today we have a presentation on how your work sites can encourage bicycling to improve health and well-being. The majority of the presenting will be done by David Pauer, who I will introduce in a moment. But before we get into that, I wanted to talk a little bit about what Bike Cleveland is, who we are, what we do, and our work we do around bicycle-friendly businesses. There we go. So Bike Cleveland, our mission is to create a region that's sustainable, connected, healthy, and vibrant by promoting bicycling and advocating for safe and equitable transportation for all. That work takes many forms, but the key form is really around advocating for bike infrastructure that makes bicycling safe and easy and comfortable for people of all ages and abilities. We also do education programs with youth all the way up to seniors, as well as a number of events and programs to encourage people to get out and ride. We are a membership-based organization. We currently have a little bit over 1,000 dues-paying members from across Northeast Ohio. If you're not a member, I encourage you to join. You can join at bikecleveland.org/member. And as part of that, you're really adding your voice to our network of advocates who are helping us push for bike lanes, trails, and a fully connected bike network. We do have a bicycle-friendly business program where our staff person, Jason Kuhn, works with local businesses to ensure that they're accommodating both to their employees who want to commute to work or encouraging them to commute to work by bike, as well as for customers. We really look at it in the realm of kind of engineering. So what facilities are available for people to lock their bikes securely, be it indoors or outdoors? Is there access to showers for employees who commute to work? Also around encouragement, so building some incentives around encouraging people to bike to work, which I know David's going to talk a lot about in this presentation. Going into businesses and doing education programs, lunch and learns, or lunchtime rides with employees, and then working to help evaluate employers' overall policies and infrastructure around ensuring it's a bike-friendly business. So our program is really built off of the League of American Bicyclists bicycle-friendly business program. So when we work with you, we then work with you to fill out the application to be recognized nationally as a bicycle-friendly business. At this point, I'm going to introduce David Pauer. David Pauer is a Bike Cleveland member. He's been a member for a very, very long time. He's the vice president in clinical operations at Customer Strategies, and does a lot of work around worksite wellness programs and encouraging people to get out and bike. So at that point, I'll turn it over to you, David.
Thanks, Jacob. I've been working now with Connecting Care for about a year. And the work with Connecting Care, we're working with companies and we're analyzing their claims data and other health indicator data, and looking at health status for their employees overall. And that's similar to the work that the Cleveland Clinic does with their employee health plan. And I'm going to talk about that specifically because I was there at Cleveland Clinic about 14 years as the director for wellness for the employee health plan. And was looking through some old presentations and came upon, the Bike Cleveland Clinic presentations that I have, and I contacted Jacob to see about, hey, I should, this is good information. It's still good information. How about doing a webinar? So, and of course, Bike Cleveland's going to help you the most with things, like on the 4 E's and how your business can become more bike friendly. And I'm going to talk briefly about, or a little bit about Cleveland Clinic and how we did that. But at the core of the presentation, I really want to talk about the reason for increasing the cycling. And a lot of times companies are relying on the CEO or another leader being very involved in cycling, and then they're encouraging it. And that's great. I mean, you always want leadership support on whatever initiatives you're having. But I believe that any company can become a bike-friendly company as part of an overall health improvement and wellness strategy, and implementing cycling into that. And what we're looking at right now in the U.S. is an even greater crisis of healthcare. That the chronic disease continues to increase, so conditions like diabetes and high blood pressure, and those are mostly due to our behaviors. So whether we're active or not, what we're eating, if we're smoking or not, emotional stress, of course, and physical activity can be a primary component on eliminating or alleviating at least those chronic conditions. And bicycling is an excellent way to improve that activity. A lot of times people ask, what is wellness? So just briefly, it's not only the physical aspects of health, it's not just the absence of disease. You want to treat the condition, but then it's that feeling of well-being and a purpose in your life and work, a good quality of life, et cetera. So it's kind of going over and above just treating that disease or condition. But recently, we've all had kind of a situation where their emotional well-being is low, and mostly due to the coronavirus issue. And you look back here, this is a chart from March 18th, and this is the daily causes of death in the U.S. Every day in the United States, there's about 7,000 deaths per day. And you can see mostly due to heart disease and cancer. And also when you're looking at the top 10 causes of death, that those are due to chronic conditions. So again, those health behaviors at play. So activity, nutrition, stress management, smoking, things like that. So you can see here, March 18th, coronavirus was, fairly low, about 40 deaths that day. But just in about 19 days, so less than 3 weeks, it became number one. And it's been 1, 2, or 3 every day since then, just depending on how many deaths were documented or unfortunately how many occurred. And again, when you look at the other causes of death, so heart disease, cancer, chronic lung disease, strokes, those again are related with all those health behaviors that either we're doing or we're not doing. And also the coronavirus really exposed issues with healthcare in the United States, that it's fragmented, that hospitals don't coordinate very often together. Usually they're competing for patients, and that the population is already fairly unhealthy. So a large percentage of the U.S. adult population has chronic conditions, and those conditions were heavily at play on the people who became critically ill with the coronavirus and also who passed away. Primarily things like high blood pressure, diabetes, et cetera. Lung disease also was a major factor. And you look at, so 70% of the U.S. adult population has a chronic condition, one or more. Many times, people have more than one. Chronic conditions are responsible for a large percentage of the healthcare costs in the U.S. Most of those chronic conditions are preventable. Not all, but most of those conditions are preventable. And those healthcare costs just keep going up and up. We're at about 18% of our gross domestic product right now spent on healthcare. So it's almost 1 out of every $5 spent on anything in the U.S. spent on healthcare. And there's a lot of issues around that. So I talk about the 3 Ps, payer, provider, and patient. So the providers are the hospitals and doctors, and how much are they charging for things? There's definitely some issues there. The payers are the insurance companies. What are they covering? What are they not covering? How much are they, paying the providers? Definitely some issues around there. But the third leg of that stool that needs to be discussed more is patients, and how much are we all driving up the need for healthcare because of our own behaviors. So that increase in diabetes, the increase in high blood pressure, which increases things like stroke and heart disease, et cetera. So you look at the chronic conditions, they're usually targeted. So as I mentioned previously, diabetes and high blood pressure, also high cholesterol. So that's, things that you hear about like high density lipoprotein or low density lipoprotein. which is LDL. LDL is the bad cholesterol. You want to get that down as much as possible. Elevated BMI, or also known as overweight, and asthma. And those are those conditions that are closely associated with driving up healthcare costs. And they're due to, again, poor nutrition. So the standard American diet, or the SAD diet as it's known, tobacco use, smoking, stress that's not mitigated, and inactivity. And I'm going to talk about inactivity specifically. And the worksite is the perfect place to implement these disease management programs and health improvement programs. You spend a lot of time there. There's a lot of levers to pull at a worksite. You can have policies and procedures implemented to improve health. And also there's the incentive, excuse me, because the employer is usually paying for the health care. So there's the incentive to try and improve the health of the population to keep the healthcare costs down. And it keeps those costs down not only for the employee, but for the employer as well. And a lot of times you'll hear people say, oh, these wellness programs, they don't work. And if there's programs where they're just participation based, go down to the cafeteria and get your screening done, and then we'll inform you what chronic conditions you have, and then we'll offer some programs that you can do. Those are a good first step. They're important to do, but they usually don't change behavior. The way to change the behavior is to have some kind of outcomes-based or goal-based program where, okay, you have high blood pressure, let's get it down under 140/90. You have, other conditions, let's get those under control. You have elevated BMI, let's have you lose 1 BMI point in the next 9 months. And those are the programs that actually reduce the cost, that reduce the unnecessary healthcare utilization and improve health, and people improve their well-being. So again, Worksite's a great place to do it. You need a good health plan design. The plan at Cleveland Clinic was designed specifically to allow people to have access to healthcare at no or low cost if they needed it. So there's no deductible or co-insurance, so no amount you have to pay up front before the insurance kicks in, and there's no percentage that you have to pay after that. And then keeping those co-pays down, the small amounts that you have to pay for seeing a provider. And that way, if people were seeking healthcare, they really needed it. And if they didn't seek it, then they really did not need it. Worksite policies that can improve health and discourage unhealthy behaviors. You have nutrition education and access. Of course, a lot of times people are obviously eating at work, so there's the food offerings that are given. Implementing things like meditation and stress management. A lot of times people are thinking like stress management is getting rid of the stressors. That's difficult to do. It's more of like, how are you dealing with those stressors? And then of course, physical activity programs, and physical activity can be a key component. And people always ask me like, what's the best physical activity to do? Like, what should I do? And I always tell them, whatever you're going to do most days for the rest of your life, that's the activity to do. So it's going to be different for everybody. And don't do short-term diet workouts, as I call them. So people will suddenly decide after 20 or 30 years of not running that they're going to train and run a marathon, and or do the P90X program or something like that. And one of two things happen. But usually they'll get hurt because they are trying to be too intense too quickly, and then they're not moving at all for maybe months. Or they're successful at that short-term goal, but then the motivation drops off, and then they're kind of right back to where they were. So a better strategy is do something that you can do most days for the rest of your life and that you enjoy. And again, that's where cycling can really fit in well. And also focusing on health improvement, not performance improvement. So people will, again, like riding a bike, right? So some people are going to want to race, which is fine. Most people are not. Most people are just going to want to go out and go on an enjoyable bike ride. And it's better to focus on that. So the activity for health improvement as opposed to trying to go faster or whatever with a performance improvement. And also not focusing on just weight loss. Activity can be, it needs to be a component of a good weight management program, but it can't be the only thing for sure. You can never outrun the donut, as I say. But also, a lot of times people too much associate the activity with the only you want to do it for weight loss. And I don't know if a lot of you probably saw the comments about the Peloton ad and the woman who was, hesitating about riding the Peloton. And everybody was commenting about like she didn't lose weight. And many of us who are thinking about activity in that expanded way were like, so what? For a lot of other reasons. And also a lot of times people are thinking that, gyms are the only or the best physical activity program. They're awesome. Definitely encourage them. You want to do some kind of resistance training at least 2 or 3 times a week. But they're that first step. And there's a lot of issues around the fitness centers. For one, they tend to encourage the only do the activity here, and the rest of the time just try and be as inactive as possible, like the guys taking the escalator up to the fitness center where they're probably going to get on a Stairmaster and ride for 30 minutes. And then also, you only are going to capture a certain percentage of people with gyms and fitness centers. At any one time, you only have about 15, 16% of the US adult population belonging to a gym. And then only about a third of that group, so only 5% of the US adult population go at least once a week. And once a week is that kind of floor minimum that you would achieve any kind of health benefit. So always, you want to stress that you have fitness center options if you can. You don't absolutely have to have it, and they're only a good first step. Also, activities like walking, running, biking, other people see you doing those, and there's more persuasion and encouragement that way. Whereas a fitness center, only the people in the fitness center see you doing that. So it tends to encourage other people right there, but it's not encouraging the inactive person, the person who's thinking about changing their behavior. And also there's that issue of you have to go to one place to get all of your activity. So there's that one location. Whereas again, with biking, walking, you can get the activity to pretty much anywhere. Okay. So briefly, I'll talk about the Healthy Choice program at Cleveland Clinic, which was implemented back in 2010. And simply, if you have a chronic condition like diabetes or high blood pressure, you join what's called a coordinated care program. It's a disease management program. And you can get up to 30% off on your health insurance premium by participating in that program and achieving very achievable goals. So getting that blood pressure down, getting your weight down, et cetera. And if you don't have a chronic condition, then you're doing activity steps or minutes. So achieving a certain amount of steps or minutes per month and averaged out for each day. And actually the activity is encouraged for the folks in the chronic condition programs as well. In fact, we have just as many people participating in activity programs who are using that to achieve the premium discount as who are in the chronic disease program. And it's just part of their participation there. But that 30% off, excuse me, and the health insurance was a huge motivator for a lot of people, for not only for the employee, but for the spouse as well, and enabled them to at least start participating in the program and achieve those outcomes. And of course, we implemented programs like walking meetings, taking the stairs campaigns, things like that, healthy food options. The one thing we did hear a lot of times from folks was that, the walking's, fine, but it's not as much fun. And a lot of times cycling was suggested as something that could be more fun and still getting that activity in. And you can see here, going back to 2009, and the program started in 2010, each year there was an increase in the people who were participating. More and more people signed up for that program. And at the same time, we got more and more people who were physically active and meeting those minimum standards. Also, at the same time, we brought down the number of smokers significantly. Excuse me. And the trend on the healthcare claims, the healthcare spend, before that program started, it was increasing by almost 8% every year, year over year over year, going up 8% each year. And the employer has to pay that, and the employees have to pay that percentage too. They're paying 20 or 30% of those health insurance premiums. So there was a cost to everyone as those trends were going up. And of course, we saw the chronic disease going up at the same time. But as soon as we started that program in 2010 and got the chronic conditions under control, that green line is the line that the trajectory is on now, where it's only going up less than 1% year over year. It's really flattened out. And again, the health plan's not doing much that's different than any other health plan, except having that program where there's an incentive to be active and to get your chronic conditions under control. And a lot of times with traditional public health and modifying health behavior, there's the focus on lifestyle factors, right? So eating better, being more active, things like that. And then you have the health outcomes. So you improve those issues around chronic disease. But one of the factors we looked at in designing the program at Cleveland Clinic was the environment, and the environment you're under that can help you and encourage you with those lifestyle changes to improve your health. So things like policies and procedures. And then in communities, how streets are designed and parks, if you have parks or not. And of course, with the worksite as well. Is it designed to encourage healthy behaviors and discourage unhealthy behaviors? And a big part of that is what's called active living. So that's where you're just trying to build 30 minutes of activity into your daily life. And that can be done in a lot of different ways. It could be walking, it could be cycling, it could be gardening. Whatever you're doing, it's going to count. And again, keeping focused on that health improvement aspect and not performance improvement. So it's not like you need to, get your heart rate up to 80% for, 20 minutes or something like that. You're elevating your heart rate, but you're doing it every day, most days, for at least 30 minutes. And there's more than the weight loss that comes with activity. And I've got, if anybody's interested, I can send you the research that's around all these outcomes from being physically active. So mood and motivation improve significantly, creativity and energy. And I would hear this a lot of times from the researchers at the Learner Research Center. They'd be stuck on a problem or something. They'd be biking home, and boom, the solution would, come to them, and they'd have to get off and write it on a pad or, speak into their note aspect, their note app on their phone. The memory and attention improve, decision making and executive functioning, that ability to keep track of a lot of different things. Your tasks for the day. Of course, anxiety and stress are reduced, as well as weight loss. Again, it can be an important part of that, but there's so many other reasons to be physically active. And again, the bicycle prescription can be a big part of that, and that's what we implemented at Cleveland Clinic. One of the things we had a couple things going on. We had, of course, we started the Healthy Choice program, so there was an incentive, and then also at the same time they were building a lot of garages. So parking was gone. You had to drive far out and park in a far out parking lot and get shuttled in. It encouraged people to bike into work because it was actually faster. And then people realized, like, hey, this is awesome. I'm going to keep doing it. So even after the parking situation was alleviated, they kept doing it. But again, the research that shows about physical activity and cycling specifically, and how it can improve that mood and motivation. And one of the things that I noticed on the days when I'd commute into work is that I was very focused, and I could do busy work, like work on a spreadsheet or data entry or something like that. And I asked one of the psychologists about that, and I said, well, is it just the activity? And they were saying, no, it's actually the balance is a big factor, because you consciously and subconsciously have to, keep balanced on your bike. Your brain stays very focused on that. And then you get a latent effect even after you're off the bike, where you're staying focused. And for some people, it might only last maybe a half hour or so, but some people it can go even longer and keep that focus. It's almost like a type of meditation where you're focusing on something, and then the brain stays focused. And then something I've been working on quite a bit is what's called the self-determination theory. And it's actually Daniel Pink in his book, Drive, which is about motivation, used a lot of this theory for his research in his book. It's created by a couple professors at University of Rochester in New York. And it's focused on 3 things that motivate people to do something. And I actually got interested in it because my sons were playing stupid video games, and I was wondering, why are they so interested in these video games? And I always wanted to kick them out and, go outside and, run around the backyard, go for a bike ride, whatever. And in my research on this, I found that self-determination theory explained this, and that there's autonomy. There's that feeling that like you're in control. So the person controlling the game, the avatar on the game, is completely in control of that. And of course, they're building up skills. They're the mastery part of self-determination theory. And then they're part of a bigger group. And a lot of times they're playing the online game with their friends from school, or even kids who can be in other countries. So they're part of a team. And I've been building that into a lot of worksite health improvement, worksite wellness programs to have these 3 things be part of that. And also performance improvement for work sites overall, and engagement in work. But it really works well with cycling, because you have autonomy because you're in control of that bike and you're kind of going wherever you want, and you're building up the skill of riding the bike, but also the things around riding the bike, like how to fix the bike, the planning your routes, and overcoming adversity about things like, getting a flat tire or things like that. And then the purpose as well. So not only your own personal purpose, maybe you're doing it to improve your health, or to save money, or, you only need 1 car instead of 2, and also improving the community overall, less pollution, things like that. So just briefly on the Cleveland Clinic Bikes program and what we implemented, and we were using a lot of the 4E research, but a lot of regular communications. We specifically highlighted physicians who are cyclists, and physician leaders were even better, because it lended a lot of credibility, and there's more persuasion in folks who were in a leadership position. We had educational programs, doing little videos, maps, where to park. We encouraged patients as well. And in fact, I had a friend who's unfortunately passed away from cancer, who used to ride to his appointments. And he just really enjoyed the cycling, and it was a way for him to do something enjoyable going to his oncology appointments. The showers at the fitness center, not only for the fitness center members, but anybody who showed a bike helmet. Just show your bike helmet and you get a towel and soap and a locker for the day. Having events during the day, like after work rides, weekend rides with the family. And then also the bike as a way to get around campus. The Cleveland Clinic and then University campus now, you're talking 1.5 miles in length. So encouraging folks, keep your 2nd or 3rd bike down here, and you can use it to commute back and forth just around the work site. And then park and ride with the Metro Parks. This is something I organized, contacting the Metro Parks to allow employees to park at the metro parks and then ride their bike into work sites. That was very popular. And then something I see as a core strategy to encourage more people to cycle on a regular basis is getting them involved on these fundraising teams. So like the Pan Ohio Ride for the Cancer Society, et cetera. And a lot of times people are training for those rides because they might be kind of long, so they're trying to get rides in during the week. They're starting off on the paths and trails and things like that, but a lot of times expanding out to riding on roads. They can be good advocates for Bike Cleveland because then they're realizing where there might be some issues around being able to ride safely on the roads. But also they're building that self-confidence and self-efficacy that, hey, I can do this. This is manageable. And then they're start riding to work, or they're riding for errands or things like that. So here's an example of the bike map for Cleveland Clinic. This is available for employees on the employee portal. And the thing we were able to do too, building those new garages and being LEED certified, we made sure that they were installing that certain number of bike racks that were required as part of that LEED certification. And as I mentioned, the team bike rides for the Cancer Society or the Diabetes Association, any of the fundraising nonprofit rides. So again, recommending, see if you can reach out if you already have an established employee wellness program, or your HR department who oversee the health plan. They're going to be a good context to implement something where you're improving the health of employees. Of course, the sustainability efforts, the green team, they're going to enjoy the cycling aspect. Parking services, a lot of times the folks managing parking welcome somebody cycling to work because it doesn't take up a whole car spot. And they can put bike racks in one car spot and park, 30 bikes. You're coordinating with the established on-site fitness center, maybe encouraging fitness center members to start cycling or to cycle to work, and they can shower and then also get that resistance training in there. And then we were really trying to work with bike shops that were close to the hospitals to have folks, go and drop off their bike in the morning, and then they could, pick it up at night if they're at work, or if they were even close enough, they could bike in, leave it there to be, tuned up or whatever, and then go pick it up after work after they commuted. So for more information, again, if any of you want any information on the research, feel free to email me, reach out on LinkedIn. And then there's specific information on the healthcare costs with the Kaiser Family Foundation. It's not associated with Kaiser Health Insurance. It's a separate group. They have excellent information on healthcare costs. Centers for Disease Control and Prevention has information on the chronic diseases, and then what's called active living research promotes those active living concepts and the latest information that shows what encourages people to be more active just as part of their daily life. And of course, the Cleveland, the Friendly Business Program. So any questions?
Yeah, feel free to, if you have any questions, feel free to unmute yourself, or you can throw a question in the chat, and then I will ask it for you.
David, so one of the places that I used to work has a wellness program, and you get points, credits for doing physical activity things. One of the things that they had on there was running a 5K,
Yeah.
How do we get bicycling events on there?
Oh, yeah, that's an excellent idea. And many companies are doing that. A lot of times the strategy I suggest is doing the minutes or steps, because people can get it however they want. So a lot of times people run, but they don't want to run a race. And then there's that difficulty in getting the information on who ran that race and things like that. Whereas the activity steps and minutes go in automatically with these newer systems through Fitbit and Garmin and things like that. But if there's an established process where they're getting event information, I would just encourage add the cycling events. So adding the
How do we do that? How do we get the insurance providers to, if they're already accepting 5Ks, how do we get them to accept the bicycling events as an event that earns points?
So probably through that same process. So however they're collecting the data on participation for the running event, you're going to need to reach out and find out what is that process. Sometimes it's a manual process where they're, getting something on paper and then entering the data. Hopefully it's an automated process where they're able to get like a spreadsheet of information of who participated and just upload it. But you can get the same information for a running event as you can for a cycling event. You just have to get that registration information, and that's always the holdup.
Well, what I'm asking is, so like the insurance company actually has a list, and they say, if you do this, you earn points. If you go to classes, you earn this. If you take nutrition classes, you earn points. And running a 5K is listed as one of the things we do. Yeah. How do we get the insurance company to actually list that riding in a bicycling event is one of the things you will get points for?
So it depends on the insurance company and how they're creating that list, like finding out who's in charge of that list at the company, and then telling them, okay, we've got these bike events. If we send you a list of those bike events, can you add them to this list of approved events?
Yeah, I think a lot of times it'd be working with the HR department who probably manages the healthcare plan, and working with them to communicate to the insurance company. A lot of the employees are riding the Fundo, or they're riding Velosan, or they're riding Pan Ohio. Yeah. It's probably getting more exercise, riding 100 miles on Velosano than you are running a 5K. So is there opportunity to add those types of activities as accepted opportunities for, lower premiums or as part of their wellness program?
The trend I see with a lot of companies now is that they're, again, using those steps and minutes data, just because they'll have an API connection to the system from Fitbit or from Garmin or whatever the company is, and it just automatically goes in and you can give people credit. And then if you run a 5K, great, you're going to get 10,000 steps or whatever from running that 5K. So still encouraging the events, but it's much easier to get the credit with that data flow than here's the list of people who participated in uploading it and things like that. But if there's already a process in place for getting credit for a 5K, you could probably easily add other events, and the bike events would be perfect.
Yeah, I think
would this be easier to do, like Jacob says, through the businesses, or to go to the insurance companies themselves?
So it depends who's giving the incentive. So sometimes it is the insurance company, like, you got Humana or United, and they've got, for any of their members, there's an incentive program that's offered. That's done by that insurance company, so you'd have to work with them. But if this is something through the employer and their specific plan, then go to, like Jacob said, go to HR, whoever implements the health plan.
And I think a lot of times what I've found working with businesses is it's almost like building an advocacy campaign. So many of the businesses we've worked with are staff level folks who are putting together a case similar to what David's presented on kind of the benefits of cycling and why it's important to encourage your employees to bike to work or to be physically active. And then presenting that to leadership, be it somebody at HR or the CEO. That's how we've gotten a lot of the bike racks installed at places like StanTac, where it's staff level folks that are really making the case and helping push it up the chain. So it wouldn't hurt to get other staff on your side to be able to help, make the request and kind of push it up. Hey, Mitch Thompson, I don't want to put you on the spot, but I know Squire Patton Boggs is a bicycle-friendly business. I believe the first in Cleveland. Did you want to talk, or could you talk? Would you open to talking real briefly about some of the things you guys did to get that designation?
Oh, yeah.
Yeah, couple things. We lobbied. So we're in Key Tower, which is a large office building in downtown Cleveland. We worked with the building to get adequate bike racks put in place in the covered parking lot that's under the building, and painting a bike lane in the parking garage, because it's a multi-level garage, to lead people to that parking area for their bikes. In addition, we worked with the bike rack at the time. That the agreement I'm about to describe ultimately wasn't sustainable with the new management of the bike rack, but we were an early sponsor of the bike rack, corporate sponsor of the bike rack, and had shower access for all of our employees there. That wasn't possible to maintain after as I said, the management shifted there. But we work with local health clubs. There's one in our building, and other. We don't have showers on site is a problem, and we're on, our floors are all in the mid to high 40s, so plumbing is a big deal. So we've done what we can to work around that. In addition, we've done lunch and learns. We have an active bike committee that works on commuting, sport riding, and health riding issues. We've had a Velisano team around which we've built a lot of cycling activities every year. And I think those are the big categories. And all of that's been well received. As a law firm, we've got people who work in records and the mailroom and secretaries and young lawyers and older partners and administrators. And one thing we've noticed with cycling, it brings people together from all the functions of the firm in a very novel way, and gives people a satisfying physical activity that really, if you think about it, no matter how competitive or fit you are or unfit you are, we can all get on a bike and find some activities to do together. So it's also been a great it really contributes to our culture and collegial environment as well. So that's probably not everything, but we also had a couple of folks who really spearheaded the effort. And we found, the health benefits are kind of hard to measure, but they do seem very real. But in terms, again, of morale and esprit de corps, that stuff is pretty widely recognized around the office. It's strong positive.
Mitch, how did that start? Like, who started the program with your firm?
We had, he has since moved on to an investment bank, but there was an associate named Austin McGuan, who was also very active in helping to form Bike Shaker, and has been involved in several other mass transit and cycling advocacy things. He and I were probably the two most active folks early on, but because of the connections to, again, Velisano was a driver of that in terms of building awareness among non-cyclists. And, we've found over the years that we have a lot of clients who have either Velisano teams or want to participate on our team or want to know more about bike commuting that we've shared information with. So it's kind of grown some natural momentum. But really all it takes, I guess my point, and maybe this is more responsive to you, David, if you have a couple of people, one or two people who are motivated, and if they're looking for ways to connect it to other aspects of an organization, you can really accomplish a lot by bringing in constituencies.
Yeah, that's what we found at Cleveland Clinic too, is those key folks in different areas, different departments or institutes.
Yeah, agreed.
Thanks, Mitch. Any other questions anybody has?
Yeah, actually, Mitch, with your employees that are commuting to work, David mentioned the park and ride feature with the metro parks. Do you find that there is like a distance limit, that people that live outside of like Cleveland and the inner ring suburbs just feel it's too far? And that's something like what the clinic has set up with the park and ride would be helpful.
Yeah, it could help. I mean, a couple of challenges there. On one of our office bike activities, we had like several aspects to this one particular event. One of which was a towpath ride. Another was a downtown scavenger hunt on bicycles. You know, photo scavenger hunt. That was really fun. And then we had the RTA bring one of the buses to where we had our lunch after all those activities.
Oh.
So that people could, in a very no stress environment, people could practice putting their bikes on the rack with no time pressure and no people on the bus waiting. And we've done other things like that to try to kind of demystify some of those processes. But what we find, Mitch, is really bike commuting drops off tremendously once you get to about anything 10 miles or more. It drops off a lot. You kind of, even though for all of us that's not very far, I think less than 10 miles is easy. 10 miles or more starts to feel very hardcore to people. We tried a couple other things that we put in place, but to be blunt, like in our case, no one ever really ended up taking advantage of them, but we had RTA passes available so that if somebody came to work and then it started to rain, or if the weather changed, that they could, because you could do it on the bus or the trains. We thought that would be a support, but nobody ended up using it like over the course of 3 years. But it was nice to have it there. The other thing we did was we had a network of folks who had bike racks who drove fairly regularly to give people an option to ride home. And we started this in kind of the pre-Uber and Lyft days, but we had cab vouchers, and now we would just reimburse Lyft or Uber. There's another concern people have is, what if I get to work and then my childcare calls, or there's some other exigency? So we had backup plans for emergency transportation for bike commuters. And I think that contributed, we're a big law firm, but we're a small business in the Cleveland scheme of things. I think that all kind of contributed to a very positive vibe, but I guess want to mention again that all of those supports we ended up having, I think, and maybe it's a good thing, but we had zero folks take advantage of them over a period of a few years. But they're all ideas that we got, from sharing ideas with others and generating. I would say the multimodal point, which was the thrust of your question, Mitch, we never did this, but maybe having a day, even if it's like a weekend day, where you schedule something fun downtown, so that no matter how long it takes or how many missteps somebody makes, you take the time pressure out of it. Because the problem is people are going to see that, and unless they're kind of a serious cyclist or commuter, they're never going to it's going to be difficult to psychologically get over the hurdle of parking their car or riding their bike to a point, getting on mass transit, then doing the multimodal thing until they get in the habit of it. What's been your experience, David, in seeing what other companies have done with multimodal?
So in fact, that's when we specifically planned programs for the weekends on the main campus, and would tell people, hey, I want you to ride down. And they would all say like, oh yeah, that was pretty easy. But then there is that whole thing of like, okay, now I'm taking it to the next step where I've got to shower and change my clothes, and how do I bring my laptop and things like that. But a lot of times it was people had that feeling, again, it's kind of that self-determination stuff, building that skill and mastery, and it became fun, like overcoming these little, problems or hurdles, and building resiliency. And that became a feeling, good feeling for people when they were able to overcome those things. But we were there to help them, to kind of steer them like, here, you could try this strategy or that strategy. But yeah, that's, for me, I love hearing about like what other companies are doing, because I'm trying to find out more about that after kind of being in the Cleveland Clinic bubble for 14 years, and expanding it. And again, my work now, I'm working with all these other companies doing their assessment of their health status and their employee health care costs. And a lot of times they're asking about, well, we really can't have a fitness program because we don't have room for a gym, or we don't have a gym. And I'll start talking about them right away about walking and cycling. And that's how you can get people to be more active, whether they're commuting to work or not.
Yeah, I think that's one of the key points of all of this is really helping people overcome those obstacles. I know Diana Hildebrand's in the room, and I know she does a lot of work around that, working with folks to kind of help them overcome barriers that, may be real, but a lot of times they're just perceived. Maybe it's just a fear of, doing something I've never done before. And, biking to work can be, something that can be scary if you've never done it before. So I think a lot of it is, finding those ways to make people comfortable doing it and doing it in a stress-free way. So like on a weekend or something like that. We've done it with a couple folks. Deltrice she calls it the Bike Buddy program, where she'll wake up early with somebody and bike with them to work and show them how to use the bus on an individual basis, as kind of like a support. So having somebody with you to do it, planning a route and all that kind of stuff.
That could be a great Bike Cleveland program.
It is a Bike Cleveland program, slightly
Bike
used,
buddies?
not used very often. But it's up on our website. Yep. Yeah, so anybody that wants to, if you're starting to go back to work, us at Bike Cleveland, we're not doing in-person meetings yet, but once we start meeting
Yeah.
folks in person, it can be something you could take advantage of for sure.
Yeah.
Any other? We have about 4 minutes left. Any last final thoughts or questions anybody has? Cool.
I just want to say thank you to David.
Yeah, that's you stole the words from my mouth.
Glad to do it. Like I said, I'm interested in hearing what other folks are doing too.
Yeah. Yes, I encourage anybody, if you do want to connect with David, his contact info is up on the slide here. Feel free to reach out. You can also go to clebfb.org, and we have an intake form if even if you're just an individual at a workplace and want some information or support around becoming more bicycle friendly at your workplace. Feel free to fill it out, and Jason at Bike Cleveland will reach out and help come up with a plan for you. So I guess thanks, David, for taking time out of your day to talk with us and share kind of your experience about making Cleveland Clinic more bicycle friendly as part of their wellness program.
Glad to do it.
Cool. Thanks, everybody. And last thing, this will be posted on our event page, so feel free to in the next couple of days go on there and share it with your friends, or share it with your boss, or share it with your colleagues at work if you want to recruit them to help you kind of push the momentum at your local business where you work. So thanks, everybody.
Thank you all.